Dillon, how's it going? So excited to have you on the podcast, man.
It's going good, man. It's good to be here.
It's been a minute since we got to see you.
Yeah, it's been a while. Like, are you second year now?
Yep, second year medical school.
All right, so step one's coming up.
Yeah, don't remind me.
My bad. When it came to mind, I was like, I probably shouldn't say anything.
I feel like we're dating ourselves here. When did we all meet in SMDP? Was that
2013, 14?
15, I think it was.
2015?
Yes.
All I remember is the late night runs to the restaurants. We went to like a Spanish, or I think it was a Spanish restaurant or something like that. It was a long time ago.
The burritos.
Yeah.
Cookout. Oh, yeah.
Burritos. Yeah. But all right, so let's get into the first question. Today's podcast is sponsored by Mission to Medicine, a lifestyle brand that represents high achievers who are pursuing and actively living out their dreams of being healthcare professionals. Check out the latest merchandise online at www.missiontomedicine.com. Use discount code MissionToMedicine10 to save 10% off your purchase. So Dillon, can you tell us a little about yourself and your upbringing and what got you interested in medicine?
Yeah, so obviously your name's Dillon Isaac, fourth year med student at USC Greenville. That's in South Carolina. I grew up in a very small town, Blackville, South Carolina, which is near Aiken, South Carolina. And if you don't know where that is, that's near Augusta, Georgia. Youngest of four, I have two older brothers, an older sister, two-parent household. Went through a fairly low-income high school, not a lot of resources. I remember really having to stick close to my guidance counselor to find resources to help ultimately promote me into the direction of higher education. I ended up going to Claflin University, which is an historically Black college in Orangeburg, South Carolina. At Claflin, that's kind of where I found myself a little bit more, got out of my shell, got involved in student leadership and community outreach. Actually ended up running for Student Government Association president during my senior year. So it was obviously something that I found a lot of passion in. Upon graduating from Claflin, I got my master's from Duke University with a master's in biomedical sciences program. I was in their inaugural class, so a lot of firsts. And then I did research in Duke's Department of Surgery for about a year before enrolling into medical school. And kind of what got me into medicine, I've always been one of those people who were interested in seeing how things worked. And I was kind of being the person to fix things. I always wanted to be a superhero. And I remember in elementary school, my grandmother being diagnosed with type 2 diabetes and ultimately having to get on dialysis. And very naturally, I was wondering, how did she go from not being dependent on these dialysis machines to kind of having to do it 3 times a week? So my idea of what a superhero was kind of adapted or evolved as I saw family members go through illness and develop chronic illness. And this is kind of similar when my uncle had triple bypass surgery, kind of similar notion, like what went wrong, how can we fix it? And even more so when my dad was diagnosed with prostate cancer and started going through treatment. So not one moment kind of led me to medicine. It's kind of a series of events that kind of underscored where my passions lied and just trying to help people.
Nice. Wow. It's really big. It's usually like a lot of different stories and experiences that we have to draw from. And it seemed like you had those different moments that really helped solidify that for you, that medicine was like something that you wanted to pursue. So it's good.
All right.
So going back to your college experience, so ultimately, what made you decide to attend Claflin, and what was your experience like there, both as a student overall and specifically as a pre-medical student there?
Yeah, so at first I was not too thrilled about going to Claflin. I got the Gates Millennium Scholarship, which meant I could go anywhere I wanted to. But I also wanted to be close to family. But so the biggest thing I was trying to figure out was how close is too close or how far is too far. But ultimately I had a conversation with my dad, and we both agreed that Claflin could kind of serve as the launching pad to wherever I wanted to go. And I think it was ultimately a good decision. As I mentioned before, it really allowed me to get out of my shell. I'm very intensely an introvert. And I
would have never guessed that.
Exactly. I would have never guessed that, honestly.
Yeah, I am. I'm not sure if I would have thrived as I did at Claflin, a big university. But it was a good experience. Like I said, a lot of student leadership, a lot of community service. I think that ultimately served me well for where I'm at now.
Yeah, absolutely. And then you kind of touched on it earlier when you kind of just talking briefly about your journey and where you've been. And I think it's important for people to know that, everyone takes a different journey to medical school. Not everyone's just going to go straight from college to undergrad. I didn't, and many people don't. So could you just kind of just take us through your journey from first deciding to, study for the MCAT and apply to medical school, and then all the way until ultimately gaining admission to medical school at USC, and kind of what challenges you faced along the way going through that process?
Yeah. So I did fairly well at my undergrad at Claflin. Didn't really fail any classes. And if there were any like indications I wasn't doing too well in a class, by midterm I was able to pick it up. But when I got to senior year, I just didn't feel mentally prepared for medical school. So that's why I bypassed going straight in and did the master's program at Duke. I felt like I just need a little bit more graduate coursework to kind of support my not only my academic strengths, but also kind of just improve those skills that I would think would serve me well in med school. I did apply during the master's program, which in hindsight was kind of a mistake because I didn't have a chance to receive all the benefits of pursuing a master's degree. This was kind of like right in the middle of it. And I think that served me well because my MCAT went up 10 points just from participating in this master's program. So not really too much effort besides just doing well in the program. But I think it's important for people to kind of have that moment of introspection and recognize whether or not you're ready. And I'm actually very thankful for the gap years that I've taken. So I took one to do the master's program, and then I did another to do research. And I learned a lot about myself during that gap. I have a huge passion for fitness and nutrition, and I'm not sure if that's something I would have been able to come across if I would have gone directly into med school. So I encourage people to take a gap year if that's something that they're interested in.
Yeah, absolutely. And a lot of people may not know, but gap years are more common actually than going straight through. So I agree. I think it's a great opportunity to get other experiences. And like you said, also too, to just enhance your application to make you successful when you apply. So I definitely agree.
Right.
Dillon, could you talk a little bit more about the transition from the master's program to the first year as a medical student? How prepared did you feel to handle the curriculum, and overall, like, what was your transition like from comparing to undergrad to medical school? What was that experience like for you?
Yeah, so each academic tier was a new level. Claflin, it was a good pace. I was able to digest everything pretty well. The Duke Master's program definitely accelerated, but still manageable once, I made some adjustments to my schedule and kind of became more organized. Med school, completely different ball game. I think we covered the entire curriculum of the master's program during the first semester of med school.
Wow.
Yeah, it was a lot. But,
that's a lot.
But I still felt prepared because a lot of things we covered in the first semester, we covered in the master's program. So I didn't have like a jolting change in pace. But by the time I got to the second semester of med school, that was an adjustment period.
Yeah. What exactly did you do differently? Like, what strategies or like approaching the material did you do differently than master's or undergrad?
Yeah, so I realized I couldn't do everything in a huge chunk of time. So I started separating my study sessions to like 25-minute blocks. It's called the Pomodoro technique. Exactly. And I found that if I did like 2 hours of that, I got a lot more in than saying I'll just sit down for 4 hours or so and try to absorb everything that I can. I was more intentional with my study schedule. I was like, all right, from 10 to 12, this is going to be studying biochemistry. And then after that, I'm going to do 2 hours in the anatomy lab. So kind of being intentional with how I section my time. And then one thing that just was a work in progress, and I didn't really get it until second or third year, was collaboration. I think a lot of people go into study and say, oh, I gotta grind, just be by myself. I can do this. But whenever I study with 2 or 3 other people and had conversations and put a lot of the material into context, I found that I was able to retain it more. So collaboration is probably the most helpful thing, especially studying for board exams.
Awesome. I definitely hear that a lot. And in undergrad, I know for sure I wasn't as collaborative, and I definitely want to make that something that I'm more doing later on in medical school. I know during the preclinical years, It's book work, but a lot of medical students are really looking forward to getting on the wards and interacting with the patients. I wanted to hear about your experiences with your patients. What has been the most memorable experience with you interacting with a patient?
Man, I have so many. What got me through the preclinical years is knowing that I would have amazing patient interactions, and honestly, I can say that I have. So I want to do internal medicine and pediatrics. It's a combined residency called Med-Peds for short. So a lot of my patient interactions come from either like really young patients or pretty old patients. And I remember during my pediatrics rotation, I was in an outpatient clinic, and there was a 7-year-old who was running on a treadmill when he shouldn't have. He fell, and he ended up coming in office, and I was able to pretty much diagnose him with a knee contusion. So I went in there, told his grandma, it's just a knee bruise, rest ice, compression, elevation, and ibuprofen every 6 hours. And they were all in agreement with the plan. And the 7-year-old jumps off the table and he gives me the biggest, most genuine hug. And I'm looking at the grandma text like, "What's going on?" And he looks at me, he's like, "Oh yeah, he's a hugger." And I'm like, "Oh, okay, clearly." But that was kind of the moment that solidified that I wanted to do something with pediatrics. And then during my 4th year, I had a 67-year-old woman who was diagnosed with malignant follicular lymphoma. And it was a bit of a sad experience because she ultimately decided to go into hospice care. But I think the empowering moment during that experience was that she was able to go on her own terms. So kind of just a spectrum of patient experiences that kind of encouraged me to do both sides of the spectrum, both pediatrics and medicine.
Nice. Those are some really good experiences right there. And I'm sure you're going to hold them with you on this interview trail and just keep them in the back of your mind. What about healthcare disparities? In medicine, there's so many different disparities that exist, especially in the African-American community. Are there any health disparities that you're particularly interested in pursuing or working towards as a physician, helping to solve or combat?
Yeah, so being a Black male from South Carolina, and kind of having an interest in adolescent medicine and transitional medicine, which I think Med-Peds will set me up well for. I have a big interest in kind of young adult health as it relates to sexual health and kind of catching chronic illnesses before they get too poorly. Like some of my best friends, they still don't have primary care physicians, and I'm always that friend that's kind of nagging them. Like you don't just go to the doctor when something's wrong. You also want to go to the doctor before anything becomes wrong. So I definitely want to get young adults access to more consistent primary care and kind of increase the literacy as it comes to adolescent health and like sexual health.
Very important. Preventative medicine is key, everyone. Preventative medicine. In regards to social media, I know today's age, and it's like very easy to get distracted with like what's going on in the world and just keeping up. I realized that over the couple of years that I've known you, that you kind of went inactive on Instagram for some time. I wanted to see if there's any pros and cons of social media, and if you would want to talk about that a little bit.
Yeah, definitely think there's some pros. One thing I love to get on is like TikTok. There's a lot of like mental health and a lot of the other med students on TikTok that kind of poke fun at some of the things that we have to go through as medical students. So it's kind of relieving to kind of see that you're not the only person experiencing certain things. Mm-hmm. But I think the con is we have a tendency to go into this mindset of comparison. And I think that's more so kind of how you tailor your social media. Kind of being a med student in my upper 20s, it's very easy for me to compare myself to like my high school classmates who already have kids and houses, and I'm still in this space where I'm still trying to build a future. So I think it all depends on how you curate your social media. But ultimately, it can be used for good if you're very intentional with it. And I'm trying to pick it back up. But I don't know. I find myself doing a little bit more interactive things with friends in person or virtually. So I don't really think about social media too much.
Love it.
Yeah, for sure. And kind of going off of like kind of the theme of talking about like personal health and wellness. One of the things that you've been extremely passionate about ever since I've known you for sure is health and fitness. So I was wondering if you could just touch on kind of like, what do you think the benefits are for busy students, whether it be medical students or pre-medical students, as well as just people in general? And what do you think the benefits are of health and fitness?
Yeah. So of course, you get to realize the physical benefits of staying active, whether it just be walking for 30 minutes a day or like an hour and a half of intense resistance training. I think they both have their certain level of benefit. But I find that exercise is probably the most underused antidepressant there is, especially during a pandemic. You definitely got to be more intentional about moving and being active and kind of get out of your own head. I think that a lot of people could benefit from just being a bit more intentional with being active.
For sure.
Yeah.
In regards to medical school, it's been so like burdensome when it comes to the debt burden. I wanted to see if you had any tips or suggestions for new medical incoming students about how they could keep down the debt, or to, basically be a little bit more intentional about how they use their money. Like, what tips or advice do you have for them?
Let's see, that's a good question because I had some issues managing my money at the beginning of med school. So what I would do, as soon as I would get my refund check, I would move it all into my savings account. And then I would just take everything that I needed for that month and put it into my checkings account. So it kind of limited what I had access to, or at least added an extra step, which made it was less likely for me to tap into those extra funds. I got in really good with my financial aid counselor. He gave me this very impressive spreadsheet. I was able to kind of keep track of where all my expenses were going. And then I also, one thing that I didn't think about until a couple of years ago was kind of being like predominantly more plant-based. Whenever I started eating more plant-based meals, I found that my grocery budget went down probably by 50%. I went from spending $100 every 2 weeks to about 50.
Oh,
yeah. Wow. Actually, going off of that, obviously the listeners won't be able to see, I guess, if they see the pictures, but you're definitely a muscular built guy, bigger guy. So like, how do you like stay full off of just eating? There's a lot of conceptions that, I have to eat meat to kind of stay full, and for those who want to build muscle. So how do you do that?
I mean, so protein shakes are a good supplement if you're not getting enough protein throughout your diet. But oddly enough, like there's certain vegetables like black beans, rice protein. I mean, if you kind of think about it, a lot of the animals that we get our protein from, cows and whatnot, where do they get theirs from? They get it from plants and vegetables. So that's I just kind of cut out the middleman by eating a little bit more plants and vegetables. Yeah.
Cool. That's something to think about. So kind of shifting gears a bit about something more of like a current topic going on today. We're in December, and a lot of people have heard in the news, the COVID-19 vaccine has come out. There's obviously been a lot of discussion about, getting people vaccinated and how we can encourage people to get vaccinated. And one of the issues is the fractured relationship between medical professionals and the Black community because of years of inequities, mistreatment, and so on. So as a current medical student moving on into physician in the next few months, what do you think about how the medical system can go about repairing that relationship and encouraging people to get vaccinated, especially considering how much of an impact that COVID-19 has had, particularly on the Black community?
Right. That's going to take a lot of time and a lot of patience. I mean, we have centuries of mistrust to kind of work through and building the Black community back up to trust medicine. I mean, even my own parents and friends, they still don't trust the flu shot. And this is, particularly frustrating for me in the medical field, and kind of constantly have to remind my parents to take medications. So I think it'll definitely take time and a lot of patience. I think it kind of comes with changing how medicine looks like right now. Like Black people make up about 13% of the United States population, but only 5% are in the medical field. If you don't see anyone who doesn't look like you, you're less likely to trust them and kind of take their advice. And the only reason I've had success with my parents in terms of their adherence to medication is because they see me, they trust me, and they acknowledge the knowledge I've attained over these last 4 years. And I think we're going to do that at a larger scheme on the United States healthcare.
Yeah. And kind of going off of that, which you touched on a bit, your third year experiences, but what were your interactions like specifically like with your Black patients? And did you feel like you were able to build a better rapport with them because they maybe saw someone that looked like them and someone they felt like they could trust? Or what were your interactions like in regards to that?
Man, they are all amazing. It's like you get that brief moment of telepathy, and you like look them in the eyes, and not one word is exchanged, but they look at you and you can tell that they proud of you, and you just kind of give them that look of satisfaction, like I'm glad I could be there, like as a part of your care.
Yeah.
It's a real magical experience. You can meet patients and they kind of see themselves in you.
Yeah. Wow. That's awesome. I'm definitely looking forward to that. I'm still a few more months, like you said, step, but I'm looking forward to that opportunity during third year for sure.
Yeah, it's worth it, man. It's worth it.
Keeping on that same track of clinics, Dillon, what specialties specific are you trying to aim towards, or you're aiming towards right now? And
Yeah,
why did you choose that?
I'm looking to adolescent medicine, or transition medicine. I did my adolescent medicine rotation about 2 weeks ago, and I got to see a lot of underrepresented minorities in the clinic, who kind of just didn't have any type of support system.
Mm.
It just kind of got me thinking, I wish I had a physician like the adolescent medicine doc I was working with when I was growing up. And I feel like I could have bypassed a lot of the struggles and the mental gymnastics I had to work through as an adolescent and young adult if I had a physician kind of in my corner, like the one I was working with. So I kind of want to serve in that role. Thinking about transitional medicine, that's essentially working with pediatric patients who have chronic illnesses like kidney disease, sickle cell disease, things like that.
Mm.
And kind of help navigate them as they transition from pediatrics to adult medicine. And I just had a couple experiences on my pediatrics acting internship that kind of encouraged me that I would like that, like working with that patient population.
Very nice.
Yeah.
It's interesting that you say that, because I've actually I watched a documentary before, and one of the issues that they talked about was younger patients, specifically young Black patients with sickle cell, and how many times when they go into to the physician, to doctor, emergency room, whatever, for care, particularly when they're in pain, sometimes there's a mistrust that they're maybe just be coming to get the pain medication, or different things like that. So I definitely think that's an area that I imagine that you kind of see yourself being that bridge, particularly with those patients.
Yeah, absolutely. I was on my pediatric pain medicine rotation, and there's a 15-year-old girl admitted for pain crisis secondary to sickle cell disease. And I remember we were rounding on her in the afternoon, and she was just in extreme pain. She wasn't responsive. She was crying. So I knelt down beside her bed, and we watched TikTok for like 30 minutes until her mom came in. So it was a very powerful moment. I was able to connect with her through TikTok, of all things.
Yeah, absolutely. That's amazing. I'm looking forward to seeing, what you're able to do in that field, and kind of make some changes and make some improvements. So that's awesome.
Yeah.
Kind of like moving away from school and medicine for a minute. Obviously you're a busy guy, you're a medical student, as well as all the other things you have going on. But what are some of the things you enjoy doing outside of medicine to kind of de-stress, and what have you seen as the benefits for you when you take time to do those activities?
Yeah, so I do love working out. I love going to the gym, which has been a little bit of a challenge during the pandemic. But I'm in South Carolina, where they're a little bit looser with the restrictions. So I'm still able to go to the gym, but I'm a little bit more cautious. I wear a mask with a little bit more space in between the fabric, so I'm not inhaling fabric if I'm breathing too hard.
Right.
And I usually go around 7 o'clock at night when there's like maybe 4 or 5 people in the gym at a time, so I'm able to space out. But I love to work out consistently. I know if I go 2 more days without working out, I just get this mental fog, and it's not good for anybody. My dad always tells me you can't do any good if you're no good. So I always try to make sure I'm in a good headspace. And one thing that I've gotten into, especially when the gyms were closed, is like mindfulness walking. So taking a 10 to 20 minute walk and kind of just like feeling the air travel through my lungs, feeling my feet touch the ground with each step, feeling the arm swing. And I find like that kind of brings me at a good headspace as well. So little things.
For sure. And I think one of the challenges that students all specifically often face is that, like, when they take that time away, they feel like that's time that could be spent studying. So it's kind of hard for people to kind of like step away sometimes. So how do you manage that to kind of ensure that you keep your head like in a good space, but also maintain a balance between, fitness, which is important to you, and keeping your head right, but also making sure, you're getting enough time studying and preparing for your exams and rotations and things like that?
Yeah, I quickly realized that I'm more productive if I've taken care of myself first. So whenever I'm doing my calendar for the week, some of the first things that I put on there are either like the mindfulness meditation or like an hour to hour and a half gym session. And I know if I get those things out of the way, then I'm more likely to be more motivated and more intentional about my work. So it kind of takes a little bit more intention about like pulling yourself away from the books and getting those things done. Because there have been times where I would feel guilty for going on a walk or going to the gym, but
Mm,
at the same time, I'll be sitting at my desk for 3 hours, not really retaining anything. And then I'll go to the
mm.
gym anyway and find myself able to retain a lot more information. So if I would have
So
been more
very,
intentional about getting that out of the way, probably could have had a very productive study session.
that's a good point you made. That's a really good point. You got to take care of yourself before you get bogged down into the books, and you're just wasting time. You're not efficient. You're not being the best. You're not performing the best.
Exactly.
What advice would you give pre-medical students or medical students incoming now that you're a fourth year, looking back, looking at your younger self coming in? What advice would you give us, next generation med students, pre-med students, how to maneuver through the medical school modules and blocks?
Yeah, and this is like a piece of advice I'm telling myself, especially through interview season and especially just taking my step two boards. Be kind to yourself. I feel like as pre-med students and medical students, we're probably our hardest critics. Like we'll tell our parents, I passed this exam, I didn't do that well. And our parents would be so excited for us, but, we didn't get the mark that we wanted. And I think that kind of takes away from the celebration of us being in medical school and like kind of following our dreams. So kind of just be kind and show yourself compassion. There's a lot of things I was stressing about like during the first 2 years, even trying to get in med school that in hindsight didn't really make much of a difference. Especially if you're in a medical school that has a pass-fail curriculum, like you don't have to get that high B. You can take care of yourself.
Solid.
For sure. Well, thank you so much. We really appreciate you taking some time out of your schedule to come on and talk to us and dropping some knowledge and just sharing your experience, man.
It's a pleasure. It's always good to talk to you.
Thank you so much, Dillon.
No worries.
All right. Talk to you later.